Rosie, stop stressing out about your head to toe. I'm going to teach you a way that you're actually going to be able to understand it. After watching this video, I want you to be able to do a head to toe in under 2 minutes. So first, we're going to walk into the room. We're going to greet the patient. We're going to say hi, do all that stuff. Hand hygiene. We're going to identify the patient. We're going to tell them why we're there. Then we're also going to assess kind of what's going on with their mental status, if anything is out of the norm. Then I want you to check any safety issues. Then we're going to move on to vital signs. Temperature, respiratory rate, blood pressure, pulse, oxygen sat. I want to know if they're on room air or if they're on supplemental oxygen. I want to know how it's being delivered and how many liters per minute it is. I also want to know their pain assessment, and I like to do the PQRST. Then I like to move on to neuro, which I kind of do when I'm talking to the patient already. First, we want to make sure they're alert and oriented ×4.
Huh?
Then I want to make sure that they're communicating properly. Then we're going to do sensations in all limbs. Then we're going to do our grip strengths with our hands, and we're going to do arms, legs, feet if we're feeling frisky. For respiratory and cardio, you can switch which ones you do first, but for me, I like to do respiratory. I just like to knock it out of the way. We're going to look for the work of breathing, the depth, the effort, and then we're also going to look for their patterns and the sounds. If they have a cough, we want to note that. We want to ask them if they have any sputum. Then you're going to auscultate in 6 spots at the front, 6 spots in the back. Remember, starting up here on the front. Moving on to cardio, first I want you to auscultate the S1 and S2, apical pulse. I want you to note the rate and the rhythm of that one. Then we're going to do our radial, pedal, and tibial pulses.
Beefing with my chick while I'm in jail.
They are equal on both sides. Look at the color and temperature of the extremities. And I also want you to do the cap refill on the fingers and toes. Less than 3 seconds is normal. I want you to check for edema. We're looking for pitting or non-pitting, and then we're going to rate it on a scale from 1 to 4. For GI questions, I want you to ask if they have any problems swallowing, if they have an appetite,
I'm hungry.
In a minute.
been nauseous or vomiting, passing gas, their last bowel movement, and I want you to inspect the abdomen. I want you to see if it's flat, concave, scaphoid, or protuberant. Then I want you to auscultate for vowel sounds. We're going to listen in all 4 quadrants, and then if you don't hear anything, listen for 5 minutes. Then I want you to palpate the abdomen for tenderness or pain. That can indicate a couple different things. Then we're going to move on to urinary. We're going to ask how many times they are avoiding a day.
1, 2, 1, 2, 3, release them.
We're going to ask the amount, roughly, the color, odor, and clarity. Any abnormal things, any trouble going to the bathroom, any trouble starting the stream, any incontinence, and then we're going to ask for any pain or odor. We're going to see if they have costal vertebral pain in the back. That can indicate a kidney infection. Then we're going to move on to musculoskeletal. Sometimes I like to do it with neuro. Ask for their ADLs if they have any problem getting ready in the morning, bathing themselves. We're going to see their range of motion. We're going to know if they use any mobility aids, and then we're going to see if they're at fall risk.
I've fallen and I can't get up.
Then we're going to know the color, the temperature, if it's moist or dry. We're going to do the turgor. We're going to see the skin integrity, assess skin risk over bony prominences. Before we leave the room, I want you to note safety ×4. Ask them if they need anything, and then do hand hygiene.
Nina. I'm not gonna lie. Nina.
I hope this helps some of you. If you have any questions, leave them below. If you want that PDF, you know what to do.
I wish I had a free bag of chips.
I'm here to help a girl out, so I got you.